Our guest is Dr. Deanne Henderson, and we're very pleased to have you here. What made you want to become a dentist?
When I was 15, I got braces, and it did wonders for my teeth. And after that, I'm like, that is what I want to do.
Really? Well, you come from a dental family, I think it's safe to say. Your husband?
Yes, and my father.
Your father-in-law?
Yes.
But you have your own practice.
Yes.
Where are you located? Tell us a little bit about it.
I'm located at 10 Mile in Coolidge in Oak Park, and I've been there for 3 years, but I've been practicing for 11 years.
Now, do you do family dentistry, or are you specializing in any certain field?
Yes, I'm a small family-oriented dental practice where we see patients from ages 2 to 102.
You've been in practice for how long did you say now?
11
years.
Yes.
What have been the big changes you've seen since you first started and up till today?
Oh, the cosmetic dentistry is a big change with the veneers coming, the braces, the Invisalign braces, which is, I provide those for patients as well. And digital radiography is one big change where it delivers less radiation to the patients, and you get to see the x-rays. It's less time. You get to see the x-rays right away, instantly on the computer screen.
Obviously you have to be very, very well educated to do what you do. How much schooling does it take for somebody that may be watching as a young person that would like to get into dentistry?
Well, it takes 4 years of undergraduate college and then 4 more years of dental school.
Deanne, what are some of the new technologies that we can see as far as dental work for patients and for people like you?
One of the new advances is implant dentistry, and another thing is oral cancer screening exam, Visalite. We are doing that a lot now, catching oral cancer at its very early stages. So we're very excited about that.
Well, hey, I've certainly learned a lot. I thank you so much for being with us. Deanne Henderson, the husband's a dentist, father-in-law's a dentist, all in the family. Yes. We're so happy to have you. Again, tell us where you're located.
Located in Oak Park on 10 Mile and Coolidge Highway.
Okay, thank you so much for being with us. Now, if you're a dentist, we'd love to have you on our program. Be sure and give us a call, the number you see on your screen, and visit our website. And if you're not a dentist, please visit our website and call us anyway. We'd like to get to know you a little bit better. Thanks so much. All of us, every single one of us, has to go to a dentist. Certainly one of the absolute best is Dr. Sharon Stewart from Lathrop Village. Now, Dr. Stewart, you are an orthodontist as compared to what I guess is generally referred to as a family dentist. Tell me the difference between the two.
Well, the difference is I have extended training and a master's degree in orthodontics, which is treatment of crooked teeth, which is braces, and that is all we do. We treat the alignment of the teeth, we treat jaw problems, we treat habits with kids like thumb sucking and tooth grinding. We treat temporomandibular joint dysfunction, which is clicking and popping in the jaw.
Of all of those, what do you think are maybe the most common things? Because I know my dentist has always said, something, you grind your teeth, you got to do something about it. What do you find is the most common thing, and how is it treatable?
Well, grinding is considered an oral habit, and it can occur in children as well as adults. Many children grind their teeth at night, and parents complain about the noise it makes. It can also damage the teeth and wear down the enamel. So the best way to treat it is with a removable appliance that's worn either at night when grinding, or if grinding or clenching occurs during the day, it's worn during the day also.
Dr. Stewart, why is it, especially in this day and age, people are still scared to death to go see a dentist?
Well, the reason is the old-fashioned memories that they have of being in pain, being nervous, or not having the opportunity to have continued dental care in their area. And so they're going in at a time where they're already in pain and apprehensive, trying to catch up. Now, the techniques that are involved in treatment of patients has advanced and continues to advance. The orthodontic appliances are much smaller, much more comfortable, and more advanced. And we have a lot of different options for the type of appliances that patients get now, including Invisalign, which are clear aligners that are worn.
Dr. Stewart, for the layman, like I certainly am, what is Invisalign specifically?
Invisalign is clear aligners that are worn that are specifically made from molds of the patient's mouth that snap in. They appear to be clear. They're changed every 2 weeks to gradually align the teeth, and for people who are concerned about the appearance or the comfort of braces, that's oftentimes an option.
One of the things I would like to mention, Dr. Stewart, is that you have achieved a certain level in your profession that's called a diplomat. What exactly is that?
Well, it's a diplomat of the American Board of Orthodontics, where I had to do case presentation, I had an oral and written examination, and I was critiqued by a group of my peers for a certain status and level of ability and training.
Oh, that's great. Dr. Sharon Stewart, thank you so much for being with us.
Thanks for having me.
Sure.
Enhancing your appearance and self-image can bring out that beautiful smile.
You know, we certainly hear about specialists all the time, but probably the most important aspect of going to the dentist is a dentist that can see your entire family, and you're a family dentist. Tell us about that.
Family dentistry or general dentistry is pretty much just self-descriptive. We see a variety of things from cleanings to doing simple restorations, fillings. We also do things such as dentures, bridges, and a great deal of cosmetics.
You know, I think a lot of people associate cosmetic dentistry with being cost prohibitive. That's not the case anymore, is it?
No, it isn't. Once again, the improved materials have come down. They're much easier to use, therefore not as much time is involved, and consequently the fees are reduced because they're easier to use and it's easier procedure.
And everybody wants to have a nice smile, let's face it. Now, I don't know about you, but when you're talking about a family dentistry, you're dealing with the entire family, obviously. And if you're anything like me, you're a big baby. I mean, how do you deal with children who are very apprehensive as well as adults who are apprehensive?
There's a variety of ways and things that we can do. First, we try and introduce, especially for children, we try and introduce them to the office, have them come in and just look around the office prior to doing anything. And this is why it's very important to start bringing children at an early age. So they come to the office having a pleasant experience as opposed to the first time that they come in where they're in pain, and then it becomes a whole traumatic issue after that.
You know, I think one of the important things when you're looking for a family dentist is referrals. And I think that, and this really says a lot about you, doctor. You have a lot of referral business, which means that your current patients are very, very happy with what you do, and other people say, hey, come on and down and see him. He does good work.
We try and accommodate our patients. We do the best that we can, and yes, we do get a great number of patients. In fact, 90% of our new patients come from referrals. So it tells us that we must be doing something right.
I guess so. Dr. Ron Martella, thank you so much for being with us, and we appreciate getting to know you a little bit better.
My pleasure. Thank you.
Thank you.